Hello again, this is Corey Podbelski, the director at Spectrum Physical Therapy in Niantic. Came here today to talk to you a little bit about imaging studies, things such as X-rays or MRIs or CT scans. Um, in the setting of physical therapy, we see these a lot coming from folks with both orthopedic and neurological conditions. Most commonly, I would say we see them a lot in the spine, so MRI or CT of the neck or of the low back. Um, Nowadays, there's actually a lot of research looking at these imaging studies and what exactly they're telling us and what exactly they may not be telling us at this point. It's been long held for years that MRI and CT is the gold standard in directing care for patients. And what we're starting to find now is that a lot of these imaging studies are probably done unnecessarily um, and maybe causing more harm than good. There are, of course, situations that might be emergency or might definitely warrant imaging studies. But for a patient with nonspecific neck pain, even for someone who has symptoms down into the arm of pain or burning or numbness tingling, for a lot of these folks, if they're not showing any signs of any serious pathology, you probably don't need an imaging study, at least not to start physical therapy right off the bat. Um, Try not to get too heady, too researchy here, but there are a ton of studies looking at healthy individuals, and they've gone in and scanned their backs or scanned their necks, and a great portion of those patients come back with some sort of abnormality. Excuse me, abnormality on these studies. One study off the top of my head looking at 1,200 healthy patients with no neck pain or no arm pain, they looked at all their necks and they found that 87% were having disc bulges, commonly a C5-6 or C6-7. Um, and there's a ton more of this research looking that, if you scan all these healthy folks, a lot of them have disc bulges, disc herniations. When does that become relevant? Um, again, it is relevant for some folks, but the trend we're trying to push and we're starting to see come around a little bit is that we would rather folks start treatment first versus getting that MRI done. Um, what the MRIs and CTs are doing, they're driving up cost a lot. So you're paying more for your bout of healthcare versus getting into someone like a physical therapist and starting treatment earlier, which shows to have a better benefit. Um, Thinking about getting into an orthopedist or a neurology office sometimes could take weeks. And if you're getting an MRI on top of that, that might just prolong that period even more. Um, Physical therapy is safe to start for folks who even have confirmed disc herniations that might be causing some pain into the extremities. So again, we push that, the shorter duration the symptoms have lasted, if you get into a physical therapist sooner, your outcomes will often be better. So if you've had MRI scans done and CT scans and found out that you've had some things in your back, that's okay. That's good information for us to know. But we just try to encourage you not to let that stuff worry you. Of course, looking at an image and looking at a disc bulge can be scary looking because you have what looks like to be a problem right in front of you. But we find that these are very common instances that occur, very treatable. A lot of folks do very, very well with physical therapy. Hope this answers some questions about diagnostic imaging. If you have any questions or comments, please add them below on our Facebook or YouTube page. And thanks for listening.